It is a degenerative process that is occurring in a part of the eye called macula. Macula is the centermost part of our visual field. So the macula corresponds to the centermost part of your visual field. Any kind of a degenerative process, generally related with age, causes blurring of vision and changes in your visual pattern in this particular area. This is called macular degeneration. The most common finding or symptom or whatever it is an elderly patient coming with a blurring of vision. The blurring of vision can be of 2 or 3 types. Sometimes they say the straight lines they are seeing as curved lines. Sometimes they say that they are watching a TV or something. They say the borders of the TV and the visual field are good, but in the center they are seeing blurring of vision. And then in some there is generalized loss of vision. They do not see very clear vision. So the most commonly seen symptom is visual loss. There is no permanent cure for this disease. There are 2 types of macular degenerations, dry and wet. Dry is the most severe form and it is seen most commonly also. And the wet is a second type of form. In dry, there are in the macular area, you will see deposits of proteins and other exudates which are called drusen. So for that, there is no treatment, but we generally give high doses of vitamins and antioxidants. It worked not to cure permanently, but to delay the worsening of the disease. In the wet type, there is growth of blood vessels just below the upper layer of the retina. So for this type, which is less commonly seen, there is there is a kind of treatment which is not permanent, but it helps to delay the prognosis. We generally give 2 types of treatments. One is injections. These are called VEGF injections. With these injections, when given into the eye, they slow down or stop the process of blood vessel growth. And the other type is to use the laser treatment. This is a little more effective in treating the wet type of macular degeneration. It can lead to complete blindness, but we cannot say like a total darkness of vision. But the most important part of our vision, which is the central part, can be pretty defective. So even if they are seeing some form of light and all, their quality of life can be significantly decreased. Most common thing there is to maintain a healthy lifestyle. If the cause for the macular degeneration is not genetic, but the other causes, then you can prevent them by maintaining a very healthy lifestyle, exercising properly, taking care of your hypertension and all these things, having foods rich in antioxidants, occasionally checking your vitamin levels and maintaining them well, a very low fat, high fiber diet, all these things, and a regular checkup. One of the most common thing is people when they come to the doctor with blurring of vision, that itself is a later diagnosis. It must have started some time before, at least a few years before by the time we got the symptoms. So a yearly checkup, at least after 40 years of age, a yearly checkup can help recognize the earlier signs, and we can start the treatment very early and prolong the progression of this disease.